A controversial change in health policy could make a COVID-19 booster shot harder to get this year. The FDA says yesterday it will start limiting the updated vaccine to people 65 and older or people at high risk of serious illness if infected. So let's talk about all this with CBS News medical contributor Dr. Celine Gounder. She is editor-at-large for public health at KFF. We're always glad to have you here at the table. Listen, I just went and got my booster. Just last week, I went and got one.
Oh, wow.
I know, because I'm very diligent and very afraid. But I know so many people of all ages that say, I'm done, I'm not getting it anymore. So what do these new guidelines say, and why now?
Well, the guidelines are, in fact, taking away the option to be getting a booster. I think until now, people have been opting. Do they want to? Do they not?
Yes.
Now, if you're under 65, you may not be able to get an updated booster. So they, and also for people who are high risk, they will still have access. So if you are over 65, if you are high risk, so have an underlying medical condition, and they are including women who are pregnant or recently pregnant in that group, they would still have access to updated boosters on the basis of antibody data. But for people who are younger than that, they are requiring clinical trials that, quite frankly, because of how long it takes, how expensive they are, it's very unlikely that they would happen in time for an updated booster for those younger age groups.
So it sounds like that the FDA is taking a more evidence-based approach. Is that not true?
Yeah, I don't know.
Because there's pushback.
That looks skeptical.
There's a little doublespeak going on.
Okay.
So
Yeah.
normally, what would happen here, at the very least, there would have been what we call a meta-analysis or systematic review, where they take all of the data on all of the vaccines to use to date, all the information, summarize that. That was not done. So what you got here was a 2.5-page paper, which was really a policy opinion piece in the New England Journal of Medicine in a town hall meeting. Also, normally, when you have a big change like this at the FDA, this is done much more transparently, where it would be done publicly. You might remember, if you were a big nerd like me, you could watch these kinds of proceedings live on YouTube. All of the scientific slides are provided. None of this happened this time.
Bottom line, if you're under 65 and healthy, no COVID booster. That's
It's going to be, yeah. If you're healthy, you're unlikely to be getting access to a COVID booster moving forward.
All right, Dr. Celine Gounder, thank you.